This is a multi-part series, and the first one I'm talking about is how drugs are impacting the lives of youth in the United States. And I will be doing a few more episodes, one particularly directed at India and a few other countries, as to how drugs are overtaking the lives and actually destroying the lives of the youth of a particular country. Here we are going to talk about the United States, and I'm just going to walk you through some of the things that are happening in the United States. If you look at drugs, the original drug was opium. And over time, opium has evolved and it can be broadly categorized into four different generations. The fourth generation of deadly prescription narcotics like fentanyl threatens the US youth. I mean, this is very, very dangerous, and I'll explain to you why. And you can take a quick look at what is the reason why this is becoming so significant. The war on drugs has become, in fact, one of the most talked about points in the 2024 elections because it has been suspected that China has been manufacturing fentanyl and then they have been finding ways to get it into the United States, Canada, and so on and so forth. And how are these things classified? We'll start with the opium derivatives. The non-synthetic, that is, these are things that actually are available as crops, like for example, poppy. You will get things like morphine, which was introduced in 1850s, codeine by Roche in 1880s. Then you have the synthetic derivatives. That means these are chemically synthesized in a lab. Oxycodone, which was started by Purdue Pharma in the 1990s, and now fentanyl, which is really taking on a big form now, and that was done by Janssen J&J in 1960s. Now, we're going to concentrate on fentanyl because this is the most deadly opioid drug known to man. The drug overdose today in the United States results in 125,000 people dying every year, 1.25 lakhs. What is fentanyl? Fentanyl is a potent synthetic opioid drug approved by the Food and Drug Administration for use as an analgesic, that is pain relief, and also as an anesthetic, that is to put you into sleep for an operation or a procedure. According to the Centers for Disease Control and Prevention, CDC, fentanyl analogs were involved in roughly 2,600 drug overdose deaths each year, and in 2011 and 2012. Now, what is the dosage that can kill you? 2 milligrams. That is 2,000ths of a gram leads to the death of an adult. And some say that once somebody gets hooked on fentanyl, within 18 months that person is going to die. Well, let's take a quick look at the history of fentanyl. The company Janssen Pharmaceutica first developed fentanyl in 1959. During the 60s, fentanyl started to be used as an intravenous anesthetic called Sublimase. It wasn't until the mid 1990s that the fentanyl patch was introduced and it could be used in the treatment of chronic pain. Chronic pain happens for people who've got, say, some diseases such as cancer. It results in a lot of pain, and these are used, opioid-based drugs are used, and IV is used to try and lessen the pain. After the introduction of the patch, other ways of delivering fentanyl were introduced, like the Actic lollipop. It was painted on a lollipop and you just bought it at a store and you just, sucked on it, and lollipop and the fentanyl slowly entered your bloodstream. Today, where does fentanyl come from? Most of it comes from China. China exports many different types of fentanyl products, including raw fentanyl, fentanyl analogs, and counterfeit prescription drugs like oxycodone that are laced with fentanyl. And let's take a quick look at all the different things that happen. First of all, look at the roots here. You have 1, 2, 3. I'll explain to you what 1, 2, 3, 4, 5, 6 means. You can see the text there, but I'm going to enlarge this text and show it to you. Basically, two of them are coming into Mexico in a form where it has to be processed further, but there are also others making its way into Canada and United States. It's a very, very deadly way in which these things are being shipped. Fentanyl in powder form and pill presses are shipped via mail services, just like postal. That is the first thing I showed you. And then the powder fentanyl are processed and mixed with heroin sold as heroin or pressed into pills and sold in the Canadian drug market. Some fentanyl products are smuggled from Canada into the United States for sale on a smaller scale. So this is the danger that lurks for Canada. You see the arrow 2 there, right? Then the next one, 3, the powder fentanyls are processed and mixed with heroin or sold as heroin or pressed into pills and sold in the United States drug market. That is 3 there, where you're seeing that is coming into the United States. And then the powder fentanyls are cut and diluted for further smuggling or pressed into counterfeit prescription pills containing fentanyls are smuggled from Mexico into the United States. Remember I told you about drugs being smuggled through trucks? Khalistani connection? Well, this is connecting the dots here. This is why this has become such a potent and difficult problem to solve. You see the arrow going into 4. That was the raw materials come into Mexico, and then the diluted powder and counterfeit prescription pills are smuggled from Mexico into the United States. Number 5. What are the precursors needed? And this 5 is in that it is in China. What are the precursors, like beginning materials and things like that? These are shipped via, again, mail services. These precursors are used to manufacture fentanyls in clandestine laboratories. 7 precursors are likely used to manufacture fentanyls in clandestine laboratories. So essentially you see 3, 8, all these things are happening in the North American continent. 3 is United States. The 1 arrow 7 is missing, but that actually points to United States. So you understand the route, how it goes. You can also see sometimes the arrows going in and out of United States. Some things go from 7, like for example, the arrow 7 goes from US into Mexico, and then the finished product comes back from Mexico into United States. So US is clearly the biggest market, and these are the source points, and these are the reception points. And the US border agents seized approximately 200 pounds of fentanyl among other synthetic opioids. In comparison, in 2014, they seized only 8 pounds. You see the 25-fold growth. Now, what is the new threat warning from the federal agencies DEA and FDA? The US Drug Enforcement Administration, DEA, is warning the American public of a sharp increase in the trafficking of fentanyl mixed with xylazine. The US DEA, xylazine is also known as tranq or tranquilizer. I think it's a short form for tranquilizer. I don't know much about it. You can look it up. The FDA is aware that xylazine is increasingly detected in the illicit drug supply and in drug overdoses. So what is the US doing about it? Well, for one thing, some of the presidential candidates such as Vivek Ramaswamy has made this his front and center pitch for how he will regulate this. He says, I'm going to send the United States Army to get rid of all these production labs that are happening in Mexico, and also put very sharp curbs on what China can and cannot export to Mexico. This is a really huge problem. Remember, somebody who gets hooked on fentanyl, 18 months is their lifetime, period. It's a very, very sad and dire situation that stares in the face of United States. So I hope I have explained the dangers of these drugs to our viewers, and we're going to have more follow-up hangouts on this, and you will be able to get a better idea for this. But the most important thing is to teach your children to stay away from drugs. Thanks for watching. Please like, share and subscribe to our channel, and don't forget to click on the bell button for notifications. Namaskar.